You know something needs to change. You're ready. So you start looking to finding support. Do you want therapy, coaching, counseling? And just like that, the thing that was supposed to help starts to feel like another thing that you have to figure out. So you close the tab. Sound familiar? That's what we're talking about today because this is the Better You Show. Welcome to the Better You Show. I'm your host, Doris Efford, and I'm here with the Better You Coach team. We have the happiness igniter herself, Coach Joyce, our favorite mindset and hypnotherapist, Coach Tiffany, and of course, the wisdom whisperer herself, Shelley McEnroy, the registered therapeutic counselor. And we're also so lucky today that our returning guest, Dr. Lisha Antica, is here with us. She is a PhD in transpersonal psychology, founder of Your Own University, and someone who's spent over 20 years working at the deepest levels of identity and healing. Lisha, thanks for coming back.
You are so welcome. It's such a joy to be here. I have had so much fun.
Today, we're getting into something that I suspect has maybe held some people back from getting the support that they need. Most of us have spent years trying to feel better, trying to grow, trying to shift something that just won't budge. And when we finally take the plunge to get help, nobody ever handed us a map that said, here are your options. And here's how to know which one is for you. That changes today. Psychology, counseling, coaching. Most people use those words like they might mean the same thing. Or they know that they don't know how that they don't. So if you're bringing the wrong problem to the wrong person, you can do a lot of work and still feel like something just isn't clicking. So let's sort it out. What does each of these actually do? And how does a woman figure out which one she needs right now?
Of course, these are not comprehensive definitions. A psychologist or a therapist would maybe look more towards the past and resolving maybe unprocessed experiences or traumatic experiences more. And then coaching is more going forward. So maybe you have a goal that you want to achieve and you're struggling to achieve it. So a coach can help close that gap between where a client is and where they want to be. And then hypnotherapy works with the subconscious mind. So the part that runs the automatic patterns, beliefs, and habits and emotional reactions. So it often helps when someone knows what they want to do or should do, but they still can't seem to change it.
I like that you brought into the mix the hypnotherapy, and I know that you have your own special brand of hypnotherapy where you're dealing with the subconscious, but you're also dealing with the mindset portions and combining that together because they really do complement each other very well. I'm going to throw it at Dr. Lisha here. It's a little bit more about psychology and how someone might know if they need her type of help.
So I actually was one of those students that I just kept going to school, kept going to school, kept going to school because who I want to help and who I do help is such a niche, right? Survivors of sexual abuse. And I couldn't just do it one way because they were stuck. And I actually did it backwards. I started somatically with more coaching and nutrition because I knew there was a lot of gut response in it. And then over the course of the 20 some years, somewhere in the middle there, I got my master's and learned about all the different tools in psychology and counseling and did those hours. And then I've moved away from it and I'm back into coaching. So I really love this question because women spend thousands of dollars not realizing which room they should be in and they go into wrong rooms. So psychology to me helps us understand ourselves as humans. So how we think, how we behave, how we adapt, and how we make meaning of it all. And yeah, it looks at the past, it looks at patterns, it looks at development. And we tend to be trained in evidence-based frameworks, and Shelley probably can say a lot more about that. Counseling to me, and when I was in the counseling field, I was working in an addiction center, and I was trying to do trauma therapy and in the past because that was my focus, and it blew up. I learned the hard way because they weren't ready. So counseling to me means like emotional processing and relationships, grief in that present moment, like life transitions, and difficulties in relationships like communication. Where coaching, and I train coaches, and coaching is so different because coaching assumes that the client already has the wisdom of what happened, and we often refer people out. I'll recommend them to go to a Shelley or somebody like that to go and get that wisdom and figure out how their brain kind of works, and then focus focus on the outcome. Like Tiffany said, the accomplishments, the identity work, a lot of education, I think, comes from a coach, just depending on what coach, and there's so many different segments of coach. I don't think any of these are, like, better than the other, but we said in our last episode, it starts with self-awareness. And then I think it really comes into it all of these tools, like, help you with embodiment and getting out of intellectual entertainment and circling. Shelly, I would love to know your take on it from all of your practice.
I guess what I do is help people move past what is stuck in the past and understand and heal by delving into what's happened and where it comes from. And it is about grief, and sometimes it's about anxiety, and sometimes it's about trauma and not having healed, and a nervous system that the alarm's turned on and it's just not going to shut off no matter what you do, no matter how much yoga you do, no matter how many breathing exercises you do. And people say to me, I've already taken my how many ever limit of sertraline or whatever it was for the day, and it's still not working. Well, do you have any other supports? No, I don't. They need more supports to look into where it's all coming from. So that's where the counseling, and if I put it into really simple terms, and this is very simplified. So do you have a goal, a transition in terms of a next level where you're heading? That's coaching. You're on your way. And the past has some level of healing, an awareness of where you've come from, and a wisdom and a settledness about where you've come from. And then in I guess psychology, it's exactly what you were saying, is how you are wired and how you think and your behavior, your mind. But if you're healing, and you're carrying something that needs to be flushed out and healed, then you're in more of the counseling.
I agree with what everybody's saying. You need to go through what has gone in the past and release it to a certain degree so that you can move forward. And when people come to me, they're at that point where it's like, okay, I've released, but I don't know how to move forward. I don't know how to move forward in my happiness. And that's the key right there. And that's where I would take them in. And sometimes you can do both. I feel like sometimes you can do both, depending on what you're doing therapy for and what you're being coached on, right? And then whatever else there is. I look at what I've gone through, and like Shelley said, medication, but there's counseling, there's coaching, there's EFT tapping I've used. There's all kinds of different things. Exercise, people have used nutrition, and you need all of those things. I look at my chiropractor, and he helps me definitely. He's part of my team to keep my anxiety under control. So it's not usually just one thing, but you're working with different people. And I think that's what we need to think about. Where are we? How are we feeling? And to talk to these people, because doing a happiness assessment with me, which is about a 45-minute call, means that I can talk to you and check to see that you're ready for what I'm going to be giving you. If you're not ready, then I can, hey, Shelley's here or Tiffany's here or whoever I think where they should be, or check in with Doris again because I know what she's done for me. as far as getting organized, but take that step forward and make that call and just say, okay, what do I need? And we can help you out with that.
You just sparked something in me, the prescriptions that people take or support that people take, like those don't come. A lot of people think, well, I'm in therapy because I went to see a psychiatrist and they gave me a prescription. Well, that's an MD. They have a whole other 4 years beyond me, the PhD, and they work with the therapist or an other professional, licensed professional that then treats the behaviors and beliefs in the past that created the disorder, or the disorder that is genetic and just is that we get to accept about our own identity and heal. But I hear so often people say, well, I'm on whatever medication they're on and saying I've been on it for years, so I'm in therapy. And I was like, that's not therapy. That's support. It's a coping mechanism, but it's not therapy. Therapy with any professional is some sort of action and talking and processing and learning coping skills and learning how to move forward. And I think that's really important.
I agree. And I really like how Joyce mentioned when people work as a team, because you're right. They'll, like Lisha, when you said they're given medication and they think that's enough. Oftentimes, it's not enough, that you need something else. And you're very fortunate if your professionals talk to each other or have a way of being able to work together so that you're getting what you need. Sadly, in my experience, I don't see a lot of that teamwork amongst professionals. And like Joyce said, it's really nice to have a wellness team so that you're treating every part together, because there's so many different parts to wellness.
And it should be included in our healthcare system. All of it.
That would be nice. That would be nice.
I just created that team because I knew what I needed, and I let them know what's going on with the different things. And if they don't like it, too bad, get off my team. The people that I have with me seem to understand that because I've been pretty direct with them and said, look, this is what I'm doing because this is what's working. The doctor will be, okay, as long as you're seeing your therapist still, that's great. The therapist is like, you need your medication, you need to go to chiropractor so that your nervous system is straight, and the massages you need too, right? You need to connect with your coaches because they're going to help move you forward. So there's so much going on there, and you find out you don't need them as much as you move through, but knowing that they're there and they're all there for you has made a huge difference for me.
I think you hit on something really important, taking agency for yourself, right? Being that person that's saying, okay, this is what I need. And maybe I don't know, so I need to ask, okay, what else do I need? What else would help me? What else can, and if the person says nothing, no, and I am your everything, obviously that's an issue. The thing that concerns me, we said it should be part of our healthcare system. A lot of times it's not. So that's very difficult for the person who doesn't have the financial means to be able to do that.
Yeah. Just remembering, I think a human, like we are multidimensional. The body has a system we call the brain, and we have 3 brains, and the brain connects in with our nervous system that connects with the fascia. That is our emotional body. That's a whole different system that we process through. And then we have this electromagnetic field around us that we get to learn how to process. And when we're moving through an issue, whether moving forward into a goal and regulating the nervous system to what amazement can be in front of us and saying it's going to be safe, or coping with the past and processing things out that have come to the surface, we get to go through that entire field, which takes a somatic work, a chiropractor, a massage therapist, a mental specialist, a diet, nutrition, your emotional body regulation, person, right? And if you weren't raised in a situation or a family that taught you how to take care of yourself and instilled your value within you in any and all of those levels, you just don't know what you don't know yet. And so find somebody who's either holistic in nature and can guide in all those areas, which there's not many. I'm one, but there's not many. Or put together your own team, like Joyce said, and really say, okay, what does my insurance pay for? What does that look like? And I'm in the US, and from working with a lot of people in Canada, you have it better than us. And it can get so tricky, right? So sometimes it is a book or a free thing, but having that dedication to set up a system for you each day that you're taking care of every part of you, I think is really important, as well as having that support to learn.
And I had a therapist who was trained in so many modalities. Like, she's trained in hypnotherapy. She's a clinical counselor. She's a coach. She's done somatic work. And that integral approach was what really catapulted my healing, for sure. I encourage everyone, keep getting those trainings. Don't just stop with coaching. I'm doing hypnotherapy and I'm like, hey, should I be a counselor? Should I train in somatics? Like, this is all fabulous stuff, right? And it works cohesively together as a unit to help clients heal.
At your own university, our coaching certification program, you learn somatics, you learn EFT, hypnotherapy, you learn trauma-informed care, all based on other things. You learn how to lead meditations, yoga, like nutrition, like all of it we do because I've set up this holistic thing. And that's one reason why I've really been doing this since I was 18 when I started teaching yoga. I'm 50 now. And all of the trainings and certifications I've been through are in this. I just continued to have to get the PhD, partly because of my own trauma. I'm an overachiever and I was never going to be enough. The second is because I want to work with survivors of sexual abuse, and it required that level of wisdom. And I needed to do a lot of deep dive research onto actual methods and peer-reviewed studies and stuff. And that's what a PhD is. But I train and coach teachers like that in the holistics at your own university.
As practitioners, I really believe in the holistic perspective, because we don't have that perspective. Even if we don't have the actual skill or the training in that area, we're able to see what might be needed and be able to help the client go where they need to go. And an understanding of all those different parts of how the body works and how the mind works and how the nervous system responds and the energies that we carry. And something that was very interesting to me when I was in a chiropractic appointment, and my chiropractor had his practicum student, or I'm not sure exactly what it's called, but he was doing his hours towards certification. And this was a student that I knew because I coached this person in gymnastics 15 years before. It's kind of humorous, but anyway, he looked at the student and he said, I can feel the energy of her body and she has tension. And that tells me what I'm going to be able to do and how I'm going to do it. And so he was able to say how you're going to work with me and what my level of safety and trust was. And he spoke directly to that. And as a chiropractor, I was really impressed that he was able to draw on that, because I've been to other chiropractors who just did the chop, bang, thump thing. Having that ability to address those other levels and of that our bodies and minds respond to the energy around us. And so I love it that your own university has so many offerings.
I was really blessed. When I was 21, I had cancer, and my adrenals, from things that happened when I was a kid, my adrenals were locked in fight, flight, or freeze. Like, I was locked. I couldn't digest my food, my pituitary. I was gonna excuse myself from the reality. And a chiropractor, my mom actually is a chiropractor, but she was in her practicum at the time, Shelley, and studied nearing neural emotional reflex integration. And actually, your own university has this certification too. But it reset my nervous system, reset my adrenals before it was popular. Okay, I'm 21. And I don't think any therapy, any counsel, I don't think anything would have stuck or helped me if I didn't have that chiropractor. I can't give enough kudos to chiropractic work.
It's phenomenal. And like you said, it's the people who have a bigger approach than just the specific technique that they were taught, that they have that extra sensory. It's that ability to be able to sense the little bit extra that person needs, to be able to read that person in whatever form that is necessary at the time. I think that's fantastic. Something that I did want to mention with all of this that we have talked about, you've heard a little bit about how it's taken different years, different amount of time for everybody. I want everyone to be aware that this isn't a 1 week thing. That when you start working on yourself, it's not like in a week you're going to be a completely different person with everything fixed. And no matter what kind of practitioner, that doesn't happen. You can make great strides within a single session, but that doesn't mean that however many years you've been alive before that hasn't built in and entrained so much deeper than that one session can fix.
Yeah, and it's how you frame it, right? Because maybe you're thinking like, "Oh, it's gonna take a lifetime for me because I'm excited about it. I'm like an onion. I'm peeling back the layers and I'm finding parts of myself and I'm healing it and I'm learning and I'm growing, and it's amazing. I've shifted my whole mindset about it and I love it. And I hope I'm doing it for the rest of my life."
We laid it all out there. We've got a bunch of different areas of different things for you to think about. And if you've been trying to figure out what kind of support that you actually need, that's exactly what a connection call at betteryou.coach is for. We help you figure it out. No pressure, no commitment, just clarity. The link is in the description. And to the Better You Coach team, you each showed up in your lane today, and that's exactly what this conversation needed. Thank you so very much. Lisha, having someone in the room who works at the depth that you do and the whole area, the holistic side of things for you, and who's willing to be this honest about what each type of support can and cannot do is such a rare thing. So thank you so much for being here with us today. Where can people find you and keep going with your work?
Thank you guys. This is so much fun. I'm just like, oh, beaming. Um, so to learn more about holistic coaching or like where you're at in the journey of self-care, the best place to go is yourownuniversity.com and take our quiz. And I will share with you if you're in a rebuilding phase, and I will just say, hey, connect with Doris. And go for it. And if you're ready to move into that next space of really helping and becoming an advocate, a coach, a healer, then we have multiple different certification programs for you there to really build on who you are and your best gifts.
Excellent. All of Lisha's links will be in the description. So go explore what she's built because there's a lot of great stuff in there. And to you, if today gave you even a little more clarity about where you are and what you might need next, that clarity is yours. So don't sit on it. Go ahead and take action. Make the wellness team your own. Always remember that you matter. So please take care. See you next time. Oh, hey, thanks for watching. Since you watched this video, we thought you might really like this video. Oh, and don't forget to subscribe right there for more great videos. Plus, tap that notification bell so that you don't miss any videos at all. Comment your thoughts below and see you next time.